Hello, Professor Longo. So your research over the years has shown that the fasting mimicking diet can help during chemotherapy and specifically can help the drugs work better and kill cancer cells. Can you talk a little bit about your research leading to this?
Yes, so we focused on interventions that are short-term and very broad acting. So we were able to focus on fasting. Fasting has the ability to change many, many different things. And we were successful at taking fundamental research from the lab and from the mouse all the way to clinical studies. Now we're running 6 different clinical trials. Some of them are almost finished, and these include trials at USC Norris Cancer Center, Mayo Clinic, University of Leiden, Charité University, the University of Genova. And we're very excited about the very strong results in mice showing that the fasting plus chemotherapy can lead to cancer-free survival. So essentially, the mice go from having retarded cancer growth to having no cancer left. And that's very exciting. And now we have to wait and see the results of the clinical trials, but we are optimistic.
And the clinical trials are for what type of cancer?
So the clinical trials thus far have been mostly for breast cancer and prostate cancer, and we're also now considering ovarian cancer and colorectal cancers.
Okay, so now I heard that now you're asking for funding from the Consano initiative. What are you going to do with this money?
So what we want to do, we're now asking for $300,000 to basically do the same as we did for breast cancer and prostate cancer for CLL. And we want to screen through FDA-approved drugs or drugs that are about to be FDA-approved and use the power of these fasting mimicking diets to attempt to increase or potentially greatly increase the efficacy of the therapy.
Okay, and also, so another part of your research has shown that this fasting mimicking diet can also protect normal cells from the side effects of chemotherapy.
So this is very important, and that's how we got started in this area, which is protect the patient from the side effects, the adverse effects caused by the chemotherapy, but not just chemotherapy, all kinds of different therapies. And so these interventions, the fasting mimicking diets that we use, are very effective in causing multi-stress resistance. And really what that means is causing the resistance protection against all kinds of different toxins. And so this is very appropriate for cancer therapy, because no matter what type of drugs we show to be effective against the cancer, there is a very good chance that these conditions, these fasting mimicking diets, are able to protect the patient and allow the patient to undergo very long term treatments.
So for people suffering with CLL, chronic lymphocytic leukemia, right now, how could this research help them?
So eventually, after we identify the cocktail of drugs that are very effective in combination with the fasting mimicking diet, as we've done for breast cancer and other types of cancer, we plan to move this to the clinic. And the hope, of course, is that we A, protect the patient, and B, make it a lot worse for the cancer. And considering that in mice we've been able to achieve cancer-free survival, of course that's our hope, our long-term hope. And I don't mean by long-term, I don't mean 20 years. We hope to be able to be in that area in 5 or 6 years from now.
So far, have you found that this type of diet is effective in all types of chemotherapy, or are there some chemotherapy which the diet helps better?
Well, we found it to be protective of the normal tissues against all kinds of chemotherapy drugs. And we have also found it to be sensitizing of the cancer cells in using a wide variety of tumor types. And the reason why this works is a very fundamental reason, which is that all normal cells turn into multi-stress resistance mode when placed in conditions that are extreme, such as the starvation conditions. And also it works for all kinds of cancers, we believe, because of the property of mutations, and mutations which are accumulated in all kinds of cancers make the cancer somewhat dependent on one environment, and that environment has to be high sugar, high amino acid, high growth factor environment. And so by giving that to patients, we basically give the cancer exactly what it wants. And when you starve a patient, although it's counterintuitive, that really A, protects the patient, and B, makes it a lot harder for all kinds of cancers. And we believe that this is also true for CLL. And in fact, our in vitro data, our experimental test tube data suggests that this is the case.